Hello, Everione.
I'm Dr. Edward Langley, and it's a pleasure to be speaking with you today. You've probably heard that staying sexually active is good for your health. It can lift your spirits, balance your hormones, and even benefit your heart. And for many women, that's absolutely true. But what often goes unsaid are the potential risks that can come with intimacy as we get older. After the age of 60, intimacy can affect us in different ways, and sometimes, it can even present some dangers. I don't want to frighten you, and I certainly don't want to make anyone feel ashamed. My goal is to help you protect yourself and honor the wonderful woman you are today. Doctors are beginning to see connections between frequent sexual activity in older women and certain health issues. This can include recurring UTIs, spikes in blood pressure, and in rare cases, even heart problems. But this doesn't mean you have to stop being intimate. It simply means you deserve to understand what might be happening inside your body and how to stay safe. Let's explore this together, gently and honestly. We're going to discuss some health conditions that doctors have linked to frequent sex after 60, including some that you might not have heard of before. You'll learn what signs to watch out for, how to stay safe, and why taking care of your body as it changes is a powerful act of self-love.
No Schemme, just honest Caring-Information.
Let's start with health risk number 1, recurrent urinary tract infections, or UTIs.
Hello again.
Let's talk about something that many women deal with in silence, those uncomfortable sensations after intimacy, the stinging and burning. You might have dismissed them as just a part of getting older, but what you're feeling could be more serious. As we age, our estrogen levels naturally decrease, particularly after menopause. This hormonal shift causes changes in the tissues of your vagina and urinary tract. The lining of the urethra becomes thinner, less elastic, and more susceptible to bacteria. Combine that with the friction that can occur during sex, and it creates an ideal environment for bacteria to enter and multiply. The result is an increased risk of frequent and painful UTIs. A single infection might not seem too concerning. However, when these infections keep recurring, they can damage the bladder, spread to the kidneys, and in rare but serious cases, even lead to sepsis, a life-threatening infection that enters the bloodstream. Doctors are now cautioning that older women who are sexually active, particularly with new or multiple partners, are at a higher risk. Yet, many women go undiagnosed or are told that it's simply a normal part of aging.
That's not good enough.
You deserve more clarity, better care, and the truth. The signs aren't always dramatic. Sometimes, it's just a frequent urge to urinate, a slight burning sensation, or some discomfort at night. If you experience these symptoms after intimacy more than once, it's time to listen to your body, not ignore it. There are gentle ways to protect yourself. Urinating right after sex, rinsing with warm water, and staying hydrated can help flush out bacteria. Some doctors recommend vaginal estrogen creams to help restore the protective tissue. Others might suggest low-dose antibiotics for persistent cases. You might also find benefit in cranberry extract or probiotics.
Warte für you choose, don't suffer in silence.
You're not being overly sensitive or demanding. You're being wise and strong because intimacy should leave you feeling closer, not worse. Let's make room for both connection and self-care. Now, let's move on to health risk number 2, heart strain and blood pressure spikes. Perhaps you felt it, your heart racing after sex, a quicker pulse, a slight pressure in your chest. For some, it's just part of the experience, but for women over 60, these sensations can be early warning signs of something more serious, cardiovascular strain triggered by sexual activity. You might think intimacy is mostly about emotions or hormones, but it's also a physical activity, an exertion, especially for the heart. During arousal and orgasm, your blood pressure increases, your heart beats faster, and your circulatory system goes into a temporary overdrive. In younger bodies, this is usually safe. But in older women, especially those with underlying heart conditions, high blood pressure, or a history of cardiovascular issues, this stress can be risky. Recent studies have indicated that women over 60 who engage in frequent, vigorous sexual activity may have a higher risk of elevated blood pressure, arrhythmias, and even heart attacks. While the overall risk remains low for most healthy women, those with untreated hypertension or heart disease face a real danger if they ignore these physical warning signs. And here's where it gets more concerning. Many women don't even realize they have a heart problem. Symptoms in women can be subtle, such as shortness of breath, mild fatigue, lightheadedness, or just a general feeling that something is off. These signs can appear during or after sex, and they are often overlooked. The heart is a powerful organ, but it's also a sensitive one, especially as we age. This doesn't mean you need to stop enjoying intimacy. It means you need to approach it with a little more awareness and a lot more self-love. Start by talking to your doctor. A routine checkup, a heart health screening, or even just a simple conversation about your blood pressure can make a big difference. If you're starting a new relationship or becoming more physically active again, go slow.
Take your time. Let your body guide you.
Consider gentle forms of intimacy that are less physically demanding. Explore connection in ways that bring joy without pushing your limits. Intimacy should uplift you, not leave you gasping for air. You don't need to be afraid. You need information and the courage to love your body as it is right now. Let's discuss health risk number 3, pelvic floor damage and prolapse. You've probably heard of Kegel exercises, those little exercises everyone says you should be doing. But what many women don't realize is that after 60, the strength of your pelvic floor becomes more than just a cosmetic issue. It's a core part of your health, and frequent sexual activity can sometimes worsen underlying weakness, leading to conditions like pelvic organ prolapse. Let's talk about what that really means. Your pelvic floor is a group of muscles that supports your bladder, uterus, and rectum. As estrogen levels decrease and connective tissues naturally weaken with age, these muscles lose their tone. Now, combine that with regular pressure from penetration, especially if you're having sex multiple times a week, and you might be unknowingly increasing the strain. As a result, for some women, the bladder or uterus can actually shift downward, creating a bulging sensation in the vagina or even protruding through the vaginal opening. This is called prolapse, and it's more common than you think. You might notice a heavy feeling in your lower abdomen or pressure after standing for long periods. Some women report difficulty urinating, discomfort during sex, or even a feeling that something is falling out. And yet, too many of us stay silent, assuming it's embarrassing or just part of getting older. But this isn't something to ignore, because once prolapse progresses, it can require surgery. More importantly, it can greatly impact your confidence and comfort during intimacy.
So, what can you do?
First, don't push through pain or pressure. If something doesn't feel right during sex, pause, breathe, and talk about it. Second, see a pelvic floor specialist or a gynecologist who specializes in treating post-menopausal women. They can assess your muscle tone and help you create a gentle strengthening plan that's tailored to your body. You might benefit from pelvic floor physical therapy, vaginal pessaries, or even hormone therapy to help restore elasticity. Even simple daily Kegel exercises, done correctly, can create real improvements over time. This isn't about giving up on pleasure. It's about protecting the foundation of your body so you can enjoy intimacy safely, without discomfort or damage. Your body deserves care, support, and strength.
And so does your heart. You are not fragile. You are not broken.
You are simply learning what your body needs, and that is a beautiful act of self-respect. Let's move on to health risk number 4, vaginal tearing and internal microtrauma. Let's talk about something no one really warned us about: pain during sex after 60. It's more than just dryness. For many women, it's the result of vaginal thinning, tissue fragility, and microscopic tears that can lead to bigger problems, both physically and emotionally. As estrogen levels decline, the walls of the vagina become thinner, drier, and less elastic. What once felt natural and pleasurable might now feel tight, sore, or even sharp. If intimacy continues without enough moisture or flexibility, it can lead to tiny tears inside the vaginal canal, what doctors call microtrauma. With repeated activity, those tiny injuries can become larger or infected. The scary part is, you might not even realize it's happening. Some women feel soreness hours after sex. Others might notice spotting or slight bleeding and assume it's normal. But these symptoms are signs that your vaginal tissue might be injured. If left untreated, it can lead to infections, inflammation, or even chronic pain that makes future intimacy difficult. And let's not forget the emotional toll. When sex becomes painful, it can affect your desire, your self-esteem, and your relationship. You might start to avoid touch altogether, fearing it will hurt, and that distance can quietly build loneliness and resentment. But it doesn't have to be this way. First, moisture matters, and not just during intimacy. Regular use of vaginal moisturizers, not just lubricants, can help nourish the tissue over time. Look for products that are fragrance-free and made specifically for mature skin. Second, talk to your doctor about vaginal estrogen creams, which many women find incredibly effective in restoring softness and elasticity. And most importantly, take your time.
Let arousal build.
Emotional connection, touch, massage, and communication are all part of intimacy. Rushing into penetration, especially without full lubrication, is one of the biggest causes of vaginal trauma after menopause. If something doesn't feel right, pause, reconnect, try again later, or explore other ways to be close that don't involve penetration at all. You don't have to choose between pleasure and safety.
You deserve both.
Honoring your body's limits is not a failure.
It's wisdom.
Your body is still capable of love, connection, and joy. You just need a gentler path and a partner or a mindset that honors that truth. Now, let's talk about health risk number 5, hidden STIs in long-term or new relationships. You might think this doesn't apply to you, that sexually transmitted infections or STIs are a young person's problem. But here's a truth that catches many women by surprise. Rates of STIs in older adults are rising, especially among women over 60. Doctors say that frequent sex without protection can lead to hidden infections that go undiagnosed for months or even years. Why is this happening? There are a few key reasons. First, after menopause, the vaginal lining becomes more delicate and prone to microscopic tears, which makes it easier for viruses and bacteria to enter the bloodstream. Second, many older women assume they no longer need to use protection since pregnancy is no longer a concern. Third, doctors often overlook STIs in older patients, assuming symptoms like irritation, discharge, or fatigue are just hormonal. But infections like chlamydia, gonorrhea, and even HIV can absolutely affect older women, and they often present without obvious symptoms. This becomes especially risky for women entering new relationships after divorce or widowhood. If your partner has had previous sexual partners, even if he seems healthy, it's essential to protect yourself. Condoms are still the most effective barrier against infection, and regular STI screenings should be part of your annual checkup if you're sexually active. But even in long-term relationships, infections can appear. Some partners may have carried something unknowingly for years. Others may have had a past encounter they never told you about. It's not about blame. It's about protecting your body and your peace of mind. What can you do?
First, normalize the conversation.
Ask your partner when he was last tested. If he hasn't been, go together. Second, pay attention to signs like unusual discharge, pelvic pain, or itching, especially if something suddenly feels different. Third, empower yourself with knowledge. You are not being paranoid.
You are being smart.
There's no shame in wanting safety. Intimacy should bring you comfort, not confusion. You have every right to ask questions, to expect honesty, and to say no until you feel secure. Love doesn't mean ignoring your instincts. It means choosing connection and care. You, my lovely lady, are worth protecting. Let's move on to health risk number 6, incontinence triggered by intimacy. Let's talk about something no one wants to admit, but so many women silently deal with: leaking urine during or after sex. It's more common than you think, and it's called coital incontinence. For some women over 60, especially those who have had children or pelvic surgeries, sexual activity can unintentionally trigger episodes of bladder leakage, and the emotional impact can be devastating. You might start to dread intimacy, not because of a lack of desire, but because you're anxious about what might happen. You might plan everything: when you drink water, when you urinate, how close you let your partner get, just to feel in control. Even then, the fear can remain.
So, what's going on in your body? It all comes back to the pelvic floor.
These are the same muscles we mentioned earlier, the ones that support your bladder and keep urine in place. As estrogen decreases and tissue weakens, the coordination between these muscles and your nervous system can falter. Add in the pressure that builds during sex, especially during orgasm, and that can cause unintentional leakage. This doesn't make you less feminine. It doesn't make you broken.
It makes you normal.
In fact, studies estimate that at least 20% of post-menopausal women experience some form of intimacy-related incontinence, and yet few talk about it and even fewer get help. But you can get help. Pelvic floor therapy is one of the most effective ways to regain control. A trained physical therapist can help you strengthen those internal muscles in a gentle, respectful way. Some women also benefit from biofeedback devices or home trainers designed specifically for mature pelvic support. Limiting caffeine, staying at a healthy weight, and avoiding bladder irritants like alcohol or spicy food can also reduce your risk. Timing your bathroom visits before intimacy helps, but it shouldn't be your only solution. More importantly, talk to your partner. Shame grows in silence, but love thrives in honesty. If you're with someone who cares for you, they will understand. If you're not, well, that says something to you. You deserve to feel clean, confident, and free during sex and every moment after. This isn't just about incontinence. It's about reclaiming your sense of control and your right to pleasure without fear. Let's discuss health risk number 7, weakened immunity and chronic inflammation. You might not connect intimacy with your immune system, but your body sees everything, especially after 60, when your immune responses naturally slow down. Even small changes in routine can tip the balance, and frequent sex, especially when your body is already tired or undernourished, undernourished, can actually contribute to chronic inflammation and lower immunity. Let's gently unpack that. Sex triggers a cascade of hormones, including adrenaline, cortisol, and oxytocin. In moderation, these can feel wonderful and even strengthen your immune system. But when sex becomes too frequent for your body's current energy levels, especially without adequate recovery, it can overactivate stress pathways. That means more cortisol, and long-term cortisol suppresses the immune system. As a result, your body becomes more vulnerable to colds, infections, and even slower wound healing. You might find yourself catching every little virus that goes around or feeling unusually tired even after rest. Some women experience worsened autoimmune symptoms, increased joint pain or headaches, not realizing it's tied to their bodies being overloaded. Here's where it gets tricky. This doesn't mean you're too old for sex. It means your immune system is more delicate, and it needs rhythm and balance, rest, hydration, gentle nourishment. Think of intimacy as a form of exercise. If you wouldn't run a marathon 3 times a week, you may not want to strain your immune system that often either.
So, what can you do?
First, listen to your energy cues. If you feel unusually drained or achy after intimacy, your body might be asking for a longer recovery period. Focus on sleep, whole foods, hydration, and gentle movement between encounters. Second, check in with your doctor about any chronic symptoms like recurring yeast infections, fatigue, or slow healing. These might be signals that your immune system needs extra support.
Third, protect your peace.
You don't need to perform or prove anything. You have nothing to prove to a partner or even to yourself. Being connected to your body sometimes means saying, "Not tonight," and honoring that with grace.
Your health matters. Your comfort matters.
You are not selfish for choosing recovery. You are wise and worthy of wellness in every form. Let's move on to health risk number 8, emotional exhaustion and hormonal imbalance. Let's step away from the physical for a moment and talk about the heart, because sex isn't just a body experience. It's emotional, spiritual, and for many older women, frequent intimacy can lead to something quietly dangerous: emotional exhaustion and hormonal disruption that affects mood, sleep, and self-worth.
How does this happen?
During sex, your body releases oxytocin, the bonding hormone. It's beautiful in the right context, helping you feel close, cared for, and calm. But when sex becomes a routine without deep emotional connection, especially if it feels like an obligation, that oxytocin surge can become confusing. Your body might feel close, but your heart might feel empty. Over time, this disconnect can leave you feeling emotionally drained. Then comes the hormonal roller coaster. Even after menopause, sex still affects your endocrine system. When it's too frequent or not emotionally fulfilling, the highs and lows of oxytocin, cortisol, and dopamine can start to dysregulate your sleep, worsen anxiety, or even trigger depressive thoughts. You might find yourself waking up at 3 a.m. feeling unsettled or feeling overly sensitive to things that never used to bother you. Many women over 60 have spent years, even decades, putting others first. So when intimacy continues out of habit, guilt, or fear of rejection, it takes a toll, not just physically, but deeply emotionally. You might not even realize it until one day you just feel numb. But this is not the end of your story. You can take your emotional well-being seriously without shame.
First, check in with yourself.
After intimacy, do you feel lighter, more connected, or do you feel tired, unfulfilled, or emotionally distant? Your body's signals are sacred. Second, consider journaling or talking to a therapist about your emotional needs in intimacy. If you're in a relationship, open a gentle, non-blaming conversation about the kind of closeness you really crave. If you're on your own, you still deserve emotional safety. Even casual or new relationships should be built on trust, mutual respect, and care for your emotional boundaries. You are not too sensitive. You are incredibly wise for noticing when something feels off and brave for wanting more. You deserve joy, rest, and emotional peace in every part of your life, including intimacy, because true intimacy doesn't just touch your body.
It holds your heart.
Well, we've made it through some important information, and you've kept your heart open the whole way. That's something to be proud of. Aging brings change, and sometimes change brings discomfort, but it also brings wisdom. You now know some of the risks that many women face in silence, and more importantly, you know how to protect your beautiful, capable body. You don't have to give up on closeness or love. You just have to meet it on your terms, with gentleness, knowledge, and care. This next chapter is not about fear. It's about feeling safe, informed, and empowered exactly as you are. Since this video spoke to your heart, I invite you to share your thoughts in the comments below. Your story, your strength, they matter here. Please like this video if it helped you feel seen, and subscribe to join a community of women who are embracing this next chapter with grace, not shame. Every week, we share honest videos to support your health, confidence, and joy. And remember, we're not here to shame.
We're here to shine.